Welcome to the third episode of You, Me, and HAE, a four-part podcast series. I'm your host, Debbie, and joining me today is Alex, a social worker and Special Olympics coach who also happens to have hereditary angioedema, or HAE. HAE is a rare disease caused by either the body not making enough of a protein called C1 esterase inhibitor, often just called C1 inhibitor, or when the body makes enough, but it doesn't work right. This results in periodic swelling that can be painful, unpredictable, and life-threatening. This program is sponsored by Pharming Healthcare Incorporated. The speakers have been compensated for the presentation of this information. The information contained within this podcast is for educational purposes only and is not intended to be medical advice. This episode will discuss experiences of people living with HAE. It is important to recognize that these experiences may not be representative, as every person with HAE has a unique disease course. Now, let me tell you a little bit about me. My name is Debbie, as I said, and I was diagnosed with HAE about 10 years ago. I have 4 amazing daughters, 2 of which are also living with HAE. And I work as an English as a second language, or ESL, tutor. Another thing about me is I like to consider myself a crafty person, but in reality, I just have drawers and closets full of crafts that I halfway started, and I get all the supplies, and I think it's going to be great. And then I don't get it finished in time for that special event, and then it just stays there. But I always try to keep a positive outlook, like I do about my HAE. And I think one of these days I'm going to get all those finished in time for the right event. I don't know. We'll see. I have high hopes. This podcast series is going to exchange personal stories about living with HAE and how the disease can impact daily life. It will explore challenges with having HAE and approaches to overcome them, including leaning into your available support network. It will discuss approaches that may be helpful when engaging with your healthcare provider about HAE and HAE treatment options. In this episode, we will highlight one patient's experience with HAE, including her experiences to find an on-demand treatment that works. This is the medication you use once a swell starts and can also be referred to as a rescue therapy. So with that, I'd love to introduce you to our guest today, Alex. Alex, tell us a little bit about yourself.
Hi, Debbie.
Hey.
Thank you so much for having me on. I could relate to a lot of what you were saying, especially about the crafts. So, hi, everybody. My name is Alex. I'm 25 years old and I live in northern New Jersey. Like Debbie said, I'm a social worker as well as a Special Olympics coach. I have a passion for helping others and a desire to create positive change in the world. In my free time, I enjoy traveling, spending time at the beach, and I also have type 2 HAE. I was first diagnosed with HAE just after my 18th birthday as a senior in high school, which was about 15 years after I experienced my first swelling events.
Alex, my daughter was kind of the push factor to get us all diagnosed in our family, and she was diagnosed her junior year in high school. So that's an awkward time, I think, in life to be receiving a diagnosis like that.
Definitely.
So what was your journey to diagnosis like?
So, my journey was very similar to a lot of people I have met in the community. I guess a word I would use to describe it is rocky. So, my journey was not easy, nor was it short. My parents started noticing symptoms and body changes around the age of 3, but doctors told them I had connective tissue disorders and Raynaud syndrome. But as I got older, I was heavily involved in sports and I had a passion for dance and softball, and I never understood why I was so different compared to my friends. I was the only one I knew who would swell up or be in so much pain I was unable to practice some days. And when I was in middle school, I started to experience chronic pain daily. But again, my parents took me to the doctor where I was told I had arthritis and again, connective tissue disorders. And then transitioning into high school, my symptoms only got worse. I was then diagnosed with lupus and told to take several medications that did not make me feel better. And I felt like no one understood what was going on, and the lack of answers started to take a toll on my mental health. Only a few weeks short of graduation, I had a swell that actually landed me in the hospital for 5 days. And I remember doctors and nurses coming in and out of my room almost like a revolving door. I was the hospital guinea pig, I kept saying, and still had no answers. And it wasn't until a medical student came into my room and spoke with my mom about the diagnosis of HAE. And to this day, my family still refers to her as my guardian angel. This young girl, a medical student, announced that she was coming in off the record, and she claimed to have read about the disease called HAE in a paragraph in one of her textbooks in med school, and shared that nobody in the hospital was taking her seriously or acknowledging that this may be the answer to all my problems. My guardian angel told my mom that the hospital was unable to complete the blood work needed to confirm my diagnosis of HAE and requested that I be transferred to someone who could. And so that's exactly what my mom did. Once I was stable enough to leave the hospital, my family brought me to New York to have me tested, and sure enough, I was confirmed type 2 HAE, which means that my body does make C1 inhibitor, but the C1 inhibitor isn't working correctly. As if that wasn't crazy enough, my dad, who was in his 50s at the time, found out he too had HAE. Receiving a diagnosis like HAE is very scary, but at the same time, it was so relieving for me because for the first time in my life, I felt like I had some answers, and for the first time, I would be receiving the help that I needed.
Alex, your story is so hard to hear. To think that since you were 3 years old, you had all of these crazy things going on, and it took so long to find the answers. And this person out of the blue just happened to be at the right place at the right time for you, your guardian angel. That is great. That is
Mhm.
great. She was there so that you could find some answers.
Yeah, very lucky.
As we've discussed in previous episodes, healthcare providers often emphasize the need to have access to an on demand treatment to manage HAE swells. So, Alex, when your doctor first mentioned on demand treatments, how did that conversation go? And what were you looking for in an on demand treatment?
So, I am very lucky in the sense that my doctor and his staff have been the greatest supporters and advocates for me and my treatment. My doctor started talking to me about on demand medications and the importance of them pretty much right away. He stressed to me the importance of having an on demand medication to be best prepared for a potential attack. So my main goal with starting on-demand treatment was having a medication that, one, I could rely on in emergency situations, and on top of that, having a medication that I knew was going to act quickly and resolve my attacks. Having HAE is stressful enough. We both know that.
Mm.
I don't need the additional stress of having a medication that I can't rely on. So after sharing this information with my doctor, he suggested that RUCONEST may be a good fit for me.
Yeah, knowing that stress is often a trigger for HAE patients, we definitely need to have a medication that we feel is dependable. RUCONEST, C1 esterase inhibitor, recombinant, is an injectable prescription medicine that is used to treat swelling and or painful attacks due to hereditary angioedema, also known as HAE, in adult and adolescent patients over the age of 12. So, Alex, how did your doctor talk to you about RUCONEST?
My doctor shared with me statistics from RUCONEST clinical trials and the feedback he had heard from other patients with HAE so that I could understand the benefits and the risks of treatment. What about you, Debbie? What was that conversation like between you and your doctor?
My doctor first told me how RUCONEST works. I learned that RUCONEST increases functional C1 inhibitor, addressing the root causes of an HAE swell. I found out that RUCONEST is dosed at 50 units per kilogram with a maximum dose of 4,200 units. Also, no more than 2 doses should be administered within a 24-hour period. Then my doctor shared efficacy data for RUCONEST. In the clinical trial, about 9 out of 10 patients successfully stopped an HAE swell with just 1 dose of RUCONEST. The study included 44 patients. In the open label extension study, 44 patients experienced 170 HAE swells and received RUCONEST. In this study, 97% of swells needed just 1 dose of RUCONEST. In the primary clinical study, patients saw symptom relief with RUCONEST in 90 minutes versus 152 minutes in the group taking inactive liquid. My doctor always lets me know the safety information. In clinical studies, anaphylaxis was a serious adverse reaction that was reported. This serious event happened in a healthy volunteer who did not reveal their known rabbit allergy. The most common side effects that patients experienced were headache, nausea, and diarrhea.
My doctor also said to me that RUCONEST is delivered by an intravenous, also known as IV injection, and people with HAE can be trained to self-inject RUCONEST. Debbie, in addition to the safety information that you already shared, is there anything else people considering RUCONEST should be aware of?
Of course, my doctor also shared with me that I should not use RUCONEST if I have experienced life-threatening, immediate hypersensitivity reactions, including anaphylaxis to RUCONEST or to any other C1 esterase inhibitor product. She emphasized to call the doctor's office or the emergency department right away if I experience wheezing, difficulty breathing, chest tightness, turning blue, looking at lips and gums can be an indicator, fast heartbeat, swelling, faintness, rash, or hives. A serious side effect of life-threatening hypersensitivity or anaphylaxis was reported in a clinical study. I learned that you are not to use RUCONEST if you have a known or suspected allergy to rabbits or rabbit-derived products. It is always important to tell your doctor about all your medical conditions, including if you have a known allergy to rabbits. Before starting RUCONEST, I told my doctor about all of my current medications, as some medications, such as birth control pills and certain androgens, can increase risk of clotting problems. It is important to note that blood clots have occurred in patients receiving plasma-derived C1 inhibitor product. Also, be sure to tell your healthcare provider if you are pregnant, breastfeeding, or planning to do so. The most common side effects patients experienced during clinical studies include headache, nausea, and diarrhea. These are not all the possible side effects of RUCONEST. My doctor encourages me to tell her about any side effect that bothers me or does not go away. I can also report negative side effects to Pharming Medical Affairs at 800-930-5221 or contact the FDA at 1-800-FDA 1088 or www.fda.gov/medwatch. If symptoms persist, a second dose of RUCONEST may be taken at your recommended dose, but you are not supposed to take more than 2 doses within 24 hours. For more information, please see the full prescribing information, including the patient product information, which is available at www.ruconest.com. Alex, you mentioned that RUCONEST can be self-injected following training. What was your initial reaction to hearing that? And how did your doctor describe the supplemental training that you would have access to?
I'm going to be honest, Debbie. When first hearing that RUCONEST was administered intravenously, immediately my mind thought, nope, can't do it, not for me. I wouldn't say that I'm a needle phobic person or that I'm scared of shots, but the idea of self injecting a medication through an IV was something I could not wrap my brain around. And I remember thinking, I'm going to school for social work, not nursing. So how could I possibly do this? I think the bottom line was I was scared and overall uneasy about the idea, but my doctor fully validated all of my feelings. He explained to me in detail how the medication works and how there would be resources and people who would ensure I got to a point where I felt comfortable. My doctor explained the support services that would be available, including an RPA or RUCONEST patient advocate, who would also provide my supplemental IV injection training. My doctor informed me that there was no pressure to self inject either. If I was not comfortable doing it myself, there are on demand nurses available through the specialty pharmacy that can come and administer RUCONEST if needed.
The RPAs are helpful in so many ways. I know I appreciate that my RPA will call me just to check in on me. She comes and has lunch with me every once in a while. And I just feel like I have somebody who's really fully supporting me. But I think supplemental IV injection training may be the most important. And so for this episode, I'm excited to have Cindy, an RPA dedicated to supporting people who are being treated with RUCONEST. Cindy, tell us about yourself and why you are passionate about your work with HAE patients.
Thank you, Debbie. I'm so happy to be here. My name is Cindy, and I've been a RUCONEST patient advocate, or RPA, for almost 7 years now, and prior to that, a nurse for 14 years. I cover the Northeast region and live in Massachusetts. I support our patients and their families and really become a part of their RUCONEST or HAE journey. Having the opportunity to help others and make a difference in their lives is just so wonderful. I strive to provide a level of comfort and confidence to patients who are often nervous and overwhelmed when I first meet them.
So, during your conversations with people starting their intravenous injection training, what kind of concerns do you often hear, and how do you approach easing their hesitation? Because, like Alex, I also thought, whoa, I don't know if this is something I can do.
Yes, a lot of patients feel that way at first. So, at my initial visit with all new patients, they definitely feel nervous and feel like they'll be unable to do the IV injection. They often say, I'm not a healthcare professional. There's no way I can do this. I encourage my patients and try to work on building up their confidence right away. I like to reiterate that training is a part of life, a way for us to learn new skills and really feel empowered. This training is no different. It's a journey for you to become more comfortable with your HAE, and I am here every step of the way to support you. Also, the patients are often worried that if something goes wrong, they won't have anyone to turn to. So I remind them that we can do the training as many times as they need and at a pace that they're comfortable with. I explain that I'm there to support them every step of the way and they're not alone. I make sure all their questions are answered and they're able to repeat the steps back to me. I also like to remind them that if they need anything, I'm just a phone call away.
Cindy, I love how you talk about getting comfortable with your HAE to your patients because this is a disease that we will have for the rest of our lives, and we need to be comfortable with it. It's always important to have someone you can depend on when you're learning a new therapy. So, how do you approach IV injection training, and what resources are available for this process?
Yes, Debbie, thanks for asking. I like to provide my patients and their caregivers with as many trainings as they need. These can be in person or virtual and wherever is best for them, such as school, home, work, etc. Patients can receive as many trainings as they need and feel comfortable with. As the RPA, I can also provide training to their family, friends, coworkers, or whoever the patient wants to be trained. I like to maintain a calm and quiet environment that's conducive to learning and in a place where they feel comfortable asking all of their questions. I provide them with ongoing vein health education as well as tips and tricks surrounding their IV injections. I assist them with emergency care planning, such as making sure that they plan ahead and are prepared for whatever they have upcoming, such as maybe a trip or a special event. I provide them with tools to organize their important health documents, as well as their medications and their supplies. I also offer trainings to their local emergency rooms and their paramedics. Another thing I do is offer mindfulness training to those who want it in hopes of providing a tool to help lessen their stress and anxiety, which, as we all know, can be a big trigger for HAE swells. For patients on RUCONEST, there are additional tools that are available to help patients with self-administration to maintain vein health. The training and education that I provide as an RPA is only one part of the services available through the RUCONEST Solutions Patient Support Program. You will also have a case manager to help you navigate coverage and access. And when additional help is needed, your Reimbursement Access Director, or your RAD, can help educate you and your doctor around the insurance process. Please visit RUCONEST.com and go to the RUCONEST Solutions section to explore other resources and support programs that are available to people who are on RUCONEST.
RUCONEST Solutions is designed to help provide access-related support once your healthcare provider has decided RUCONEST is the right therapy for your HAE and you have enrolled in the program. The RUCONEST Solutions Patient Support Program is not intended to be a substitute for regular consultation with a healthcare provider regarding management of your HAE and your RUCONEST treatment. So, Alex, what was your training like? How was your relationship with your RPA? And overall, how has this training impacted your ability to manage your HAE?
So, like I mentioned before, I was extremely hesitant going into the training as I was not 100% sure if I was going to be able to learn how to self-inject RUCONEST. My RPA was truly incredible. She took the time to teach me at my speed and based on my comfort. Around the time I started RUCONEST, I was also transitioning into living away at college. I was concerned about a million things. I wasn't sure how the mailing system would work and if my medication would be able to ship to my college dorm. I was nervous to tell my roommate for fear that she might not be comfortable or be needle phobic, or honestly, just think I'm weird for having to do a medication through an IV. Because, let's be honest, whipping out a RUCONEST IV startup kit can be a little bit intimidating for those who are not used to it. I remember my RPA calling me and introducing herself over the phone, asking me questions, and truly taking the time to get to know me and my HAE. I was also fortunate that my RPA at the time also had HAE. I felt like not only was she listening, but she could also relate to my experience, and that alone helped ease some of my anxiety. The first time my RPA came to my house to introduce herself and meet my parents, she showed me some of the written tools and resources that were available about vein health, tracking HAE attacks, emergency room toolkits, and so much more. She showed me the supplies that would be getting delivered and familiarized me with them. At this point, we were not even discussing injecting. After that visit, I moved into school and my RPA scheduled a visit to come to my campus. I remember meeting her at my school diner, and she had a bunch of supplies laid out on the table. She even had a fake arm that we used to practice getting comfortable sticking the needle in. Trust me, if you want to get a million stares from strangers, inject a fake arm in a college campus diner. Looking back, I just laugh because I can only imagine the millions of thoughts going through everyone's head. On her third visit to me, we practiced reconstituting RUCONEST and getting comfortable with maintaining a sterile field, measuring out the medications, and also injecting them again into the fake arm. My RPA had tools and resources that helped me familiarize myself with my own veins and the places at which I would have the best access. I was able to get a vein finder on loan from RUCONEST Solutions to help me get comfortable. For those who don't know, a vein finder is a hands-free device designed to help eligible patients and their caregivers find a vein more easily, and it can be a very helpful tool. To learn more information about the vein finder and other available support services, feel free to check out www.ruconest.com. On the fourth visit, I successfully self-injected, and to my surprise, I was able to get it the first try. My RPA was there every step of the way, instructing me and encouraging me, and I could not believe it. I felt like I had worked myself up to thinking this was going to be an impossible task, but in reality, I was doing it. My relationship with my RPA is truly incredible. I will forever be grateful for her and her support as I navigated this process during my early days of diagnosis. My RPA also came to my home where she taught my family members and my boyfriend how to administer my medications. She even came and visited me at my college dorm where my roommate learned to administer my medications as well. Remember how I said I was nervous about that roommate? She turned out pretty great after all. My RPA has given me tips and tricks that I still use to this day, such as making a to-go bag with all my RUCONEST supplies, so it's always ready if I'm leaving the house. This training has made such an impact on me. I went from feeling so lost and unsure of what my future would look like after getting a diagnosis like HAE, and feeling defeated and uneasy at the idea of doing a medication intravenously, to not only understanding my HAE better, but also having a newfound confidence in my abilities. I can confidently say I have been self-injecting RUCONEST for the past 7 years. While I have a new RPA now, the level of support and services available are still there if I ever need a refresher training or just additional support. Now, if you were to ask me if self-injection is possible, I would not even have to think twice. I would tell you that it's the best decision I ever made. I'm able to recognize my HAE symptoms, and self-injection allows me to control my treatment on my terms.
Wow, that is great. That is really great. I love how you tell that story. As we wrap up, what would you like our listeners to remember from our conversation today?
Oh, a piece of advice that I would like listeners to remember is that you have to take the good days with the bad days. And there are going to be bad days. Days when you feel like you can't get out of bed or a swell hits you so hard that you need another day to recover. But in those moments, you must remember that it's temporary and that you will have a good day again. Do not let HAE define you, and do all you can to continue to live your life on your own terms. RUCONEST allows me to get back to the things that matter. If you are hesitant to try RUCONEST for any reason, talk to your doctor, weigh the options, ask all of the questions. At the end of the day, your doctors are there for you. Don't count yourself out before you even give yourself a chance to prove that you're capable. With RUCONEST, you have many people in your corner and a support system like no other, and for that, I'm truly grateful.
I agree 100% with that about the RUCONEST support system. It is amazing. Thank you, Alex, for this wonderful conversation and being open to share your HAE story. And Cindy, thank you for joining us to discuss supplemental IV injection training and all the other ways that you support people living with HAE. Listeners, thank you for tuning in and engaging with us. In our next episode, we're going to hear from Aaron as he shares his experiences living with HAE and how breakthrough HAE swells can impact his daily activities. I hope you will join us.